Hi, my name is Alexandria Khan. I'm a third-year medical student at St. George's University School of Medicine. I'll be presenting gut bacteria, a potential key to treating psychiatric disorders. So beginning from our introduction and the guidelines of why we researched this topic was investigating the viability and the use of prebiotics, probiotics, and fecal microbiota transplant to treat very specific psychiatric disorders, specifically major depressive disorder, bipolar disorder, anxiety disorder, autism spectrum disorder, and eating disorders like anorexia nervosa. We also investigated preclinical and clinical studies demonstrating this phenomenon that bacteria in the gut can affect mental behavior. Also, because this is relatively new, there isn't quite an elucidated reason why this is occurring, so we read through certain research to maybe potentially explain why or what is the pathogenesis of why this is occurring. For just a little bit of background, we look at commensal bacteria, meaning the bacteria that's native to the gut, how it can modulate gene expression, neurodevelopment, and motor skills. This was also shown in infants in a few studies. We've also seen that prebiotics like the SN2 palmitate can enhance beneficial bacteria, therefore supporting gut and brain health. Specifically, the enteric nervous system in the gut and limbic system in the brain, along with autonomic function, they can work together bidirectionally, meaning that there's an effect starting from the brain to the gut, and it can affect the species of bacteria that can grow there, or vice versa, that the species of bacteria in the gut can affect certain psychiatric disorders leading to changes in the brain or limbic system. We know that for standard practice in medicine, most psychiatric diseases are treated with selective serotonin reuptake inhibitors. These usually take about 4 to 6 weeks to begin to start working, meaning this person or our patients will be taking this medication for this extended amount of time without seeing any results. Investigating how gut bacteria or prebiotics and probiotics can be used may offer a faster delivery or more efficient way of achieving more symptomatic relief. In this research, we also discuss how dysbiosis, meaning the growth of bad bacteria, can disrupt the function and metabolism of tryptophan. Tryptophan is an amino acid. We know it's the basic form of a protein that can help make serotonin, which does play a very significant role in a few psychiatric disorders. Also through investigating this, that maybe through proper diet, using prebiotics, the food that the bacteria like to consume, probiotics, the bacteria itself, or the very specific method of giving these beneficial bacteria via fecal microbiota transplant, they might allow us to have symptomatic relief and by restoring gut balance. In terms of this research to begin investigating, we used a Boolean search, meaning we only used terms such as major depressive disorder, prebiotics, and fecal microbiota transplant, also known as FMT. The databases we used were only PubMed, the National Library of Medicine, Mendeley, ScienceDirect, and Google Scholar. We kept this search very narrow, only using prebiotics, FMT, depression, mental health, probiotics, psychiatric diseases, and so on. In terms of inclusion, we just kept it to the use of prebiotics, probiotics, FMT, and again, as we mentioned, for the spectrum of the disorders discussed here, it was major depressive disorder, anxiety, autism, bipolar, anorexia, and binge eating disorder, which I combined as both as just eating disorders. For exclusion criteria, we did not use any studies before the year 2023. There were no use of any review articles, meta-analyses, systematic reviews, editorials. We did not use any databases that did not offer the full text available, and only peer review articles were utilized. So to investigate each one of these studies, a quality assessment was made, where I made a table of both preclinical, the animal models, usually in mice or rats in this study, and clinical, meaning it was just patients. For each table, each study was listed by the author, the year it was conducted, the study design, like if it was a randomized control trial or not, the characteristics, meaning what population was used, how many, if they were undergoing treatment before, if they weren't going under treatment before, the modality of treatment, so if they were receiving a probiotic, exactly which species of bifidobacteria or lactobacillus, the duration for each study, and what parameters were measured. For the preclinical studies, it was a lot of behavioral type assessments. And for clinical studies, to quantify this behavior, we use a lot of surveys that were given a assigned data number. After that, these outcomes after the treatment were measured, and then an evidence level was assigned. So in terms of evidence, if it was a preclinical study, it was given a score of 0. If it was a randomized control trial, it was given a level 1. For non-randomized control trials, it was assigned a level 2. For observational studies with a control, it was assigned a level 3. And for observational studies without controls, it was assigned a level 4. Again, each evidence table was consisted of randomized control trials, a pilot control trial, or case series. Overall, this data and how this search was performed is summarized here in this table known as the PRISMA chart. And now moving on to results. So we're going to go by each psychiatric disorder and then how both clinical and preclinical data were shown in each. Okay, so in terms of results, a total of 54 studies were utilized, and of the 54, only 16 were preclinical and 38 were clinical. The average sample size in preclinical were about 42 participants, whereas in clinical studies it was about 54 participants. Overall, in both sets of studies, the majority of the data came from major depressive disorder, which may skew some of the results a little bit. And in terms of treatment intervention, 22 out of the 54 studies were based on the FMT treatment, showing the novelty of this approach. In terms of major depressive disorder, fecal microbiota transplant did show promise for treating depression and probiotics in terms of complementing antidepressants. This was seen with elevated serotonin levels, also with the concomitant use of SSRIs. They were showing this elevated levels of serotonin totally, along with elevated GABA and brain-derived neurotropic factor. In terms of prebiotics, the results were pretty inconsistent. I believe this was due to inefficient measuring of what dosage is or the full impact of what prebiotics itself do to probiotics. In terms of bipolar disorder, the gut bacteria were found to treat bipolarism, especially with fecal microbiota transplant in long-term outcomes. In terms of anxiety, gut dysbiosis, the metabolites associated with anxiety were associated with more harmful species of bacteria like the ruminococcus species. And in terms of increasing the beneficial probiotics, it enhanced levels of BDNF and improved overall sleep and anxiety-like symptoms. In terms of autism spectrum disorder, they did notice improved social behavior in both animal and human models. In terms of anxiety and eating disorders, they found more significant effect that the beneficial bacteria, as they increase, would influence hormones in the body, such as ghrelin and leptin, that altered eating behavior. In conclusion, we found that probiotics and FMT did show promise in treating psychiatric disorders. There was an association with neurochemical modulation by gut bacteria, specifically in the tryptophan pathway. We mentioned that tryptophan was an amino acid, and it has 3 sets of roles. 1 being in the formation of protein, 2 leading to the formation of serotonin, and 3 the kynurenine pathway. So far, it's been understood that kynurenine elevated levels can also lead to increased inflammation. And so both the increased inflammation and increased harmful bacteria in the gut can lead to these psychiatric like disorders, but more information is needed to understand these. In terms of the future direction of this project, I would say there needs to be more high quality future research, especially in the spectrum of the prebiotics, not knowing what is an appropriate concentration or how much or how to quantify how to treat these disorders. But I do think supplementing with prebiotics in addition to probiotics can sufficiently treat these psychiatric disorders. Thank you for listening to my presentation.